Hi everyone, I am Dr. Manaan Gandhi, an MD in Ayurveda, and in this series we are going to focus on the advantages of Ayurveda and simple but effective home remedies to solve day-to-day problems. Let's start with acidity. Acidity is probably one of the most common problems that I see in my clinic. I have patients coming from all across complaining about heartburn, indigestion, heaviness in the stomach, reflux and many other issues regarding acidity. But there are certain things that I've observed here. Number one is that most patients who come complaining of acidity seldom actually have acidity. What they actually have is acid reflux. Now you're probably asking me what's the difference between acidity and acid reflux. Well, it's huge. Acidity refers to the increase in quantity of acid, whereas acid reflux basically means that the acid that's in the stomach, it's not increased in quantity but is merely displaced. Acidity happens due to acid, whereas acid reflux happens due to gas. Let's try and understand both of these. In acidity, what happens is that the quantity of acid increases. Now, why does this quantity increase? When you have an indigestion, that indigestion stays in the body and gets fermented. And this fermentation process produces a lot of acid. Let's call this acid as bad acid, as this is not helpful for digestion. And the body itself produces acid, which is good acid, which is helpful for digestion, right? So the overall amount of acid in the body is higher than what it should be. This is acidity. Now, what we normally do with this is that we probably have a lot of cold items. Let's say we have cold milk, or we have some sweets, to dilute the acids, to just cool it down a little further. But then these things are again very heavy to digest and will further cause more acidity. Or we could probably take something that is alkaline. Things like a Gelusil or a Digene or some sort of an alkaline, either a syrup or a tablet. But that dilutes every acid, whether the good or the bad. And then when you eat, it's not going to be digested again, hence acidity. Or we can take a medicine like a rabiprazole or a pantoprazole or an omeprazole, which stops the production of good acid, hence the indigestion that initially caused acidity still remains. So now you need to take those medicines every single day, and the problem is never actually cured but relieved. This is what happens with acidity, and which is why there are so many people who are suffering for so many years. They literally have these things in their pockets because they can't sustain or live without them, because we're not treating it at the root. In Ayurveda, you can. The second problem, or acid reflux, happens again due to indigestion, but here there's a lot of gas production there, and that refluxes the acid upwards, causing heartburn, causing sour or spicy belching, causing headaches, causing multiple issues. In fact, sometimes even when you lie down, everything comes up at night. So a lot of patients sleep in a slightly inclined position to get some sort of a relief. In both these cases, with Ayurveda, when you remove the indigestion by actually digesting it, you can solve the problem. So then what do? We can use some home remedies. A very simple but yet very effective home remedy is to have fennel seeds, which in Hindi we call as sauf. Take 1 tablespoon of fennel seeds, soak it in a cup of water overnight, and when you wake up in the morning, have the water and have the fennel seed as well. A second home remedy is to take 6 balls of black pepper and swallow it down whole without chewing it 20 minutes before lunch. The third home remedy is very important, is you need to ensure your motions are clear. So there is a tablet called Haritaki or Harade, which you need to take 1 or 2 tablets depending on how many you require every night before going to bed. These 3 things, when done together, will definitely give you great results for acidity as well as for acid reflux. So these were some of the home remedies that we have. But in case if your problem is very severe, requires a doctor's intervention, we do consult online, or you could come and visit us. We'd be happy to help you. If this video has helped you in any way or form, or you feel that the contents of this video are valuable, please drop us a like. You could also consider subscribing, and you can also ding the notification bell in case if you want to know more videos that come up. Please share the video to your friends and family and to anyone you feel that it may add value. This is Dr. Manaan Gandhi. Thank you for tuning in. Namaste.